I woke up, fixed me breakfast, and I was telling my boyfriend that I wasn't feeling good. I had a sharp pain like underneath my left armpit. He told me to get dressed and everything, and he was going to take me to the Bluffton Regional. It was scary. I know what was going on because I've already had 2 previous heart attacks. I seen the doctor up there, and that's when they transferred me to Lutheran Hospital. So that made me feel a lot better because I like that hospital.
The patient, Tracy, was a 44-year-old who had been admitted the day before with acute chest pain. She was discovered to have severe coronary artery disease. Unfortunately, the cardiologists were unable to place stents to open her arteries and placed her on integralin drip.
Come out of the surgery and went back into my room, but I didn't know that I was having a stroke. And I noticed my nurse just kept going, trying to lift my right arm and my leg, and it just wouldn't stay up. It just kept falling down. And that's when she was trying to explain to me that I was having a stroke. That's when she called this doctor in that does the strokes.
When I arrived, Tracy was aphasic and had a right upper extremity paresis. Her NIH stroke scale score was 9. Her symptoms occurred at approximately 5:40 in the afternoon. I was able to arrive by 6 o'clock that evening. Her initial CT scan was negative, but because she was on the antiplatelet blood thinning medication, I could not give her intravenous TPA. I contacted my colleague, Dr. Khatri, a neurointerventionalist at the Fort Wayne Neurological Center, to see if we could perform an intervention to hopefully help her reperfuse her arteries.
And that's when they said they were taking me down to the surgery again because I had, a stroke. And yeah, I was just kind of freaking out.
We performed a CT angiogram that revealed an embolus in the M2 segment of her left middle cerebral artery. Dr. Khatri was able to take her to the interventional suite at Lutheran Hospital. He was able to administer intraarterial TPA and dissolve the clot.
I had new doctors that I've never dealt with, and they took good care of me. I feel a lot better after I got done. I was sitting up waiting on them to come back.
After the procedure, Tracy returned to her baseline neurologic status. Her aphasia resolved, her right-sided weakness resolved. When I returned to examine Tracy the next morning, her NIH stroke scale score had returned to 0. Tracy functions normally today, and Tracy and our staff at the Fort Wayne Neurological Center are very grateful for the prompt response of the nursing staff and all the healthcare professionals involved, so Tracy avoided the devastating consequences of stroke.